Hello, everybody. My name is Dr. Eric Neilson. I am the course director for the Clinical Skills 3C, 3X, and 4C course. I'm going to give a brief overview of the activities you have this semester. And let me just first start by saying congratulations. Welcome to this next step in the long path to becoming a physician. What I want you to take away from this quick discussion is basically an overview of the course, but also that all of the information you really need is in eCollege under the Clinical Skills tab with your associated semester. Please read these documents. I can't stress that enough. If you're uncertain or have some misperception or questions about the documents, do not hesitate to email me. My email address is on the first slide of the presentation. Whether you're in St. Kitts or Knoxville, I am more than happy to day or night answer your questions. In general, the overview of the course is to provide you an opportunity to practice and put into practice the skills you have been developing over the first and second semester. This includes continued practice reinforcement of history taking, physical examination skills. We will work a lot on oral presentation and differential diagnosis development. We expect you to practice and really hone your write-up documentation skills, and also provide opportunities for you to practice interviewing patients in a more challenging situation or patient encounter. You know, the overall goal of this course is to help you become a better doctor. So I hope you all enjoy these activities and really find them quite useful, which is the feedback I get from most students. The first thing I really want you to do, besides read the course documents, is complete the orientation quiz. Once again, all the documents are on eCollege. The quiz is available on CAE. You have 3 chances to score 95% or greater. So please read the documents before taking the quiz and refer to the documents while you take the quiz. This is an open book exam, quiz, whatever you want to call it. This is a required activity, unlike previous semesters where it counted as a bonus for the course grade. This is actually a required component of the course. A quick overview of the activities we have planned. The first and kind of main bulk of the course consists of what we call ESP. We'll also have a medical simulation and a special interviews skills activity as well. The ESP activity for the 3X students consists of 8 2-hour small group sessions. For the 3C and 3-4 students, these are divided into 4 2-hour group sessions. Same cases, same format. Basically, it is a history and physical exam that is performed on a standardized patient or actor. After the history and physical, we'll practice oral presentations and the generation of a differential diagnosis and appropriate workup for the problem the patient presents with. You'll have to do 1 write-up for each session. The grading is, you'll get 2 grades for the ESP activity. 1 grade is based on attendance, punctuality, and professionalism, and your participation in the session. The other component of the grade is your write-up. So each write-up will be graded by your facilitator. This activity is designed to not only help you with your practical exam at the end of the 3X04 semester, but also help prepare you for your clinical clerkships in your third and fourth year, and get the ball rolling for the Step 2 CS activity or test exam, which this activity is modeled very much after. Attendance for these sessions is mandatory. Any session in the course that involves a patient you're going to interview is what we call a mandatory attendance. Any unexcused absence results in a potential 25% reduction for your final course grade. Okay, this one unexcused absence potentially puts you at risk for failing the entire course, and of course having to repeat the semester. So we'll talk more about how you get absences excused or unexcused a little bit later. But we just want to highlight mandatory attendance is very important. Do not miss these activities, and if you do, it has to be for a good and excused reason. All documents related to ESP are on eCollege. Please, once again, read the documents on eCollege in the ESP tab. There are quite a few things we have put together, put a lot of time and effort to help improve and allow you to get the most out of this activity. One of the most important things I want you to read is the write-up rubric. This is how we grade your write-ups. Many students who struggle with write-ups really improve quite dramatically just by reading the rubric. Okay, so that's a very good place to start if you want to score well on the write-ups. The main resource for that activity is Bates, which is also in eCollege in your resources page. And there's a very good sample write-up at the end of chapter 1. I refer to that write-up constantly and encourage you all to do the same. Also, the website Up to Date, which you have access to both on mobile device and by logging in through the portal, is available, and I encourage you to become very familiar with that resource. ESP is a great opportunity for you to practice using and get valuable information from the Up to Date page. All ESP write-ups will be uploaded on CAE. If you ever have any trouble logging in and submitting your write-up, you need to email me, your facilitator, and the website or the email address on the page, on the slide in front of you, to document that you are having trouble, and this needs to be prior to the deadline for submission. So please do that if you have any issues with connectivity or access to CAE, and we will respond as soon as possible, usually immediately, to remedy the situation. The next activity I want to discuss is the special interview skills training. And the main point or goal of this activity is to provide you with an opportunity to practice interviewing a difficult patient scenario. This is for the 3X and 04 students only. The activity includes both a very short pre-test and post-test that is a required component of this activity that's also on CAE, and previewing a narrated PowerPoint presentation that gives you a few basic details about HIV and AIDS that will help facilitate your expertise when you interview the patient in this session. Please check your eValue schedule for logistics, basically when and where you're scheduled for this one session in the semester. The design of the activity is basically an emotionally charged clinical scenario. The patient is upset. They're finding out they are newly diagnosed with HIV. We will have a short discussion detailing interview techniques and tools to use when you have a challenging situation like this. We'll watch a couple demonstration videos, and then you will take turns both interviewing and being interviewed by each other while we observe and give feedback to the kind of points that we observe, and then we'll have a brief debrief or discussion after the interview. Attendance for this activity is also mandatory. Once again, the same repercussions apply. professional dress is required, and this activity will be tested in the practical skills exam components of this activity, at least at the end of the 3X04 semester. The next activity I want to discuss is the medical simulation. The main idea of this activity is for you to work in teams in a time-sensitive or urgent medical situation where you have to demonstrate clinical reasoning, appropriate doctor-patient relationship care, and teamwork skills while we together work to help take care of, diagnose, and treat a essentially critically ill patient. These activities happen in the afternoons. Once again, check eValue for the time and location of that session, and an email will be sent out as well for specific session times. This activity is for 3C and 3X students only. Semester 4C students have completed this simulation in the September or fall 2017 semester. For these sessions, we want you to wear blue scrubs, bring a stethoscope and a pen light in order for you to best take care of your patient. The format is basically a 20-minute case where we examine, assess, and treat a patient, and then a 30-minute debrief after taking care of the patient. There's a reading assignment that is released at the end of the sessions that you will need to review, and you will have a question on a mini exam related to that reading assignment. You'll be graded based on your attendance, professionalism, and participation in the session. It's essentially a pass or fail grade. You will also have this component, a simulation component to your practical exam in the 3X and 04 semester. Just some basic professionalism expectations, be on time. We really want you to what we call suspend disbelief, meaning make it feel as real as possible. Try to ignore the fact that it's a simulated scenario, that it's a mannequin. Take everything on face value and treat the patient as if it was a real human being. And you really have to get familiar with and adapted to this kind of scenario. Many of your exams moving forward, including Step 2 CS, will involve actors, and it's really a benefit for you to be able to take it as serious as possible and try to get the idea that this is a fake scenario out of your head. The next thing I want to talk about is the service learning project. You are all familiar with this. It's introduced in semester 2. Basically, for this semester, it will be a reflective project essay that you have to write and submit via CAE. It is due by the end of the 4X05 or 5C semester, so you do not have to do it this semester, but whichever semester you complete the activity in, you'll get a 5% bonus added to the clinical skills course grade. The next assignment or activity you have is the Harvey practice session or study session. For 3X students, you have to complete 2 hours. For 3C04 or 4C students, you have to log 1 hour each, where you have independent self-study. You can have facilitators, either junior or senior faculty, facilitate if you schedule those appointments. We will announce locations as they become available in Knoxville or St. Kitts. And you may do consecutive sessions, but you have to log in after each hour. The Harvey programs you're responsible for the practical exam include the normal program, innocent murmur, aortic sclerosis, hypertension, and mitral valve prolapse. Please practice these scenarios as if you're in the exam. It is this deliberate practice walking through an exam type scenario that really is the difference between doing very, very well on the exam and struggling or barely passing. Speaking of the practical exam, this is once again for 3X and 04 4C students only. Please continue to practice. I encourage all students to spend an hour or two Saturday or Sunday as a study break practicing your physical skills exam. physical exam skills, and Harvey and or simulation scenarios, just so you are very well prepared. There is no anxiety or lack of confidence walking into these exams. All exam prep documents are on eCollege. If you fail to attend the practical, there is no makeup or remediation. You get a 0 for that exam. This is one of the key components of the 3X 4C grade. The practical exam basically includes one ESP type scenario station, which you get 16 minutes to perform, one high fidelity simulation session, which you get 6 minutes to perform, and one Harvey station, which you also get 6 minutes to perform. You must average greater than 70% for all the rooms to pass, and get greater than 60% in any one room in order to pass the exam. A failing grade means a 0 for that component of your course grade. Okay, and once again, that's 30% of your course grade. Failing this exam means you are at risk of failing. It does not mean each student who fails the exam fails the course and has to repeat this semester, but it does put you at risk. If you have questions about this, please do not hesitate to get in touch. The logistics basically are professional dress, white coat, ID badge, and all your exam tools. Arrive early, at least 15 minutes before your scheduled time. If you arrive after that, there's a risk you will fail the exam. We expect, just sort of a caveat to this, we expect a minimum level of performance for your level of expertise. Your second year medical students now, we are not expecting perfection, but we do expect you to practice and have a good command of the expectations when you walk in the room. Anybody who fails, at least 5 faculty members get together, review the video, and have an internal review of the performance before we would determine that a student has in fact failed the room. If you would like to grieve your grade, you may do so. Your grade will also be subject to video review by a team, and you will be assigned the grade of that review team, which may be lower than the grade you originally got. Historically, the video review team is very close to the grade that was initially assigned, although there are times where the grade is lowered by that team, so please grieve with care. ICM lab hours, we will, at some point very soon, give those details. Typically, hours are Monday to Friday, 8 to 4. As we get closer to final exams and practical exams, they are extended from 8 to 10, but we will give those details and post specifics on eCollege. I just want to reiterate one more time the importance of attendance to these activities. Most students who fail this course and in turn fail the semester have problems with unexcused absences for these activities. Mandatory attendance are the ESP and special interview skills training. You have to be very careful and diligent about checking your e-value schedule. Make sure you have the right time, the right location, and the right day. Once again, this is a 25% reduction of your overall course grade, meaning you're definitely not getting an A if you have an unexcused activity, and you may fail the course and in turn have to repeat the entire semester. Do not let this happen to you. All excused absences must be cleared through either the Office of Student Affairs, the RUSM Health Clinic, or the Counseling Center. If you are going to miss an activity, please email your proctor. Please email me immediately and let me know what's going on. This, if nothing else, just helps create a paper trail so that mistakes don't happen in terms of you not getting points that you otherwise would deserve. Once again, don't miss an activity. And if you do not let me know if you've missed an activity, I will, by whatever way I have to, track you down. Okay? Just quick review of the grading policy. 100% of the clinical skills grade comes from the activities for the 3C semester. 70% comes from activities, and 30% comes from your final practical exam grade for the 3X and 4C students. Be professional, wear professional dress, white coat, bring your ID to everything. For the ESP and special interviews skills course, and blue scrubs are appropriate for the simulation activity. Rarely there are issues with professionalism. By far and away, most students are, quite engaged, enthusiastic, and enjoy these activities. Please do not make professionalism issues something that you have to worry about or deal with. If you have any questions, I'm always available. The email is on the first slide in the presentation. Dr. Selfridge is also available. She's the chair of the Department of Clinical Medicine. And please, just as a last note, read the course documents on the clinical skills e-college tab. And I hope you enjoy the activities we have. Thanks.